Good afternoon. This is my patient for the day. Can you tell me your name, sir?
Connor Larson,
Can you tell me where you are?
Ogden, Utah.
And can you tell me how many quarters there are in a dollar?
4.
Can you tell me who the president is?
Joe Biden.
I'd say he has ANO times 4, so we can proceed. We already did our visual check outside, the Snellen check. So we already know cranial nerve 2 is doing just fine. We're going to go back to cranial nerve 1. So I'm going to ask you to smell this for me. Can you smell it with that nostril?
Mm-hmm.
How about this nostril?
Mm-hmm.
Perfect. We're going to do 3, 4, 6. So I'm going to look inside your eyes. If you don't mind, I'm going to flash a bright light in your eye. Make sure that the pupils are equal, round, and reactive, and they are. Okay. Then I'm also going to have you tell me when this comes into view. So I've got my hand. Tell me when it comes into view.
Yep.
Perfect. How about this one?
Yep.
Nice. I'm going to have you follow this. You're going to trace it with just your pupils, if you would. I'm going to have it move various directions. Make sure you can trace it with just your eyes, not moving your head. Perfect. Can you wrinkle your forehead for me? Very nice. Can you go the other way? Very nice. So we're now going to move on to cranial nerve number 3, 5, and 7. So I'm going to have you look at me. Can you smile? Can you frown? Great job. Does any of this hurt?
Nope.
Along the sides? Perfect. I'm going to assess if you can feel this. Can you feel that?
Yep.
Sharp or dull?
Dull. Sharp.
Perfect job. Okay. Then we're going to do 9, 10, and 12. So if you could open your mouth for me. Take a look inside. We're looking for the tonsils. This is while we're in here. Okay, can you move your tongue for me? Perfect. Can you touch your nose with it? Perfect. I'm going to assess his gag reflex. Push down. Gag for me. Great job. Please tell me that's still recording.
Okay, we're good.
I think it's still recording.
Yep.
All right. Where were we? 9, 10, 12. So we just did, yeah. Let's do 11. So I'm going to have you shrug. Perfect. I'm going to have you push against this hand. You can do the same thing on this side. Nice job. Let's look at the further out away. So can I have you take your left foot and touch your right shin? Do the same thing with the opposite side. Great job. Can you hold your hands out for me? I'm going to put an object in there, close your hands around it. Can you tell me what that is?
Chapstick.
Perfect. I'm going to do the same thing on the other side.
Keys.
Perfect. I'm going to have you keep your eyes closed, keep your palms up. I'm going to draw on it. Can you tell me what that is?
Square.
How about this one?
Triangle.
Perfect. So far, so good. I'm going to have you stand up for me, sir, and you're going to go to the end of the hallway. All the way down from that end of the hallway. Can you walk on your heels to here? Long ways. Great job. Really pushing it. Okay, and on the way back, can you do it on your toes? Great job. And I'm going to interrupt, have you standing right there, turn around for me. I'm going to look and make sure, check for scoliosis, looking for step off. Looks great. Go ahead and have a seat for me, sir. I'm going to take just a second and make sure that I've gotten everything. So we did all the cranial nerves, we did the sensations, we did that, and then we looked for your balance. So I think we're moving along quite nicely. I'm going to move back to doing a visual inspection. So I'm looking at his hair, I'm making sure that there's no bald patches, I'm making sure that there's equal distribution. All that looks good. I'm going to go down the back side, I'm going to check to make sure that his occipital area looks good, looking for bruising. Moving into the ears, I'm looking for symmetry. I'm going to pull on it, tug on it, any pain associated with that when I do that?
Nope.
Please stop doing that. Okay. I'm going to look inside the ears. Perfect. Cool. We're gonna realize at this point that I forgot to do a hearing test when we did the cranial nerves. So I'm gonna go back and do the hearing test. So I'm using a tuning fork, and I'm gonna compare the air versus when I have it vibrate through the bone. Which one do you hear more of? Say air.
Air.
Do the same thing on this side.
Air. Air.
Perfect. Good job. So we did the hearing test and we visually inspected the ears. Moving on down through his, we're going to continue that down through the bone. Can you feel that through?
Yep.
How about this one?
Yep.
Perfect. Then going back up through the rest of the head. So I'm going to take a look through the nose. I'm going to make sure that the nose is intact. We're looking for any sort of septal deviation. Use that light. Perfect job. Can you open your mouth for me? Looking at dentition, looking for tonsils, making sure that those, can you say ah? Great job. Okay, also we're going to go down here, we're going to check out the lymph nodes. Those seem good. Looking for thyroid issues as well. The next thing I want to check is to make sure that there's no step-ups. I'm going to, so make sure that there's no problems with the jugular or carotid arteries. So checking on one side, I'm going to have you lean that direction. Looking for palpitation problems here. Same thing on the other side. Can I have you lean your head that way? Perfect. Okay. Now I'm going to check the pulses and compare the two. So carotid pulse versus radial pulse. Good. Same thing on the opposite side. Carotid versus radial. Good job. I'm going to check the jugular. Make sure, trachea. Make sure that that's in line. Can I have you swallow for me? Good job. Let's have you do that with water. Have you swallow for me? Great job. This is my simulated stethoscope. So I'm simulating listening with the stethoscope. So first thing I'm going to do is I'm going to listen to the carotid arteries, listen for Brutus, or however you say it. Perfect. Then I'm going to listen to the various cardiac points. So we've got the aortic, we've got pulmonary, we've got herbs, mitral, and tricuspid. Nice job. Next thing I'm going to do is I'm going to have them rotate. Can you rotate your knees for me a little bit? And I'm going to go down your back. I'm going to have you breathe deeply for me. Big inhale, big exhale, 7 locations. Here. Fantastic. This time I'm going to have you say the vowel E.
E, 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 E.
Great job. And this time I'm going to have you whisper 1, 2, 3. Great job. I'm going to check, oh, sorry, stay in that position for me. I'm going to check for Cva tenderness. Any tenderness when I do that?
Nope.
How about along the vertebral spine? Any tenderness here?
Nope.
Great job. Okay, now you can go. Now you can sit back. Can I have you lay down for me? Yeah, the finances at this place are not great. So then the first thing I want to do is auscultate, make sure that I hear all 4 breaths or bowel sounds. So I'm going to go in all 4 quadrants. Great. I'm going to also, while I'm here, auscultate for the aortic radius. Good. Get rid of the stethoscope for a minute. Then I'm going to do some palpitations. So let me know if you have any pain or tenderness when I do this. We're doing light. Any pain or tenderness when I did that?
Nope.
Nope. Then we're going to go deeper. Anything that way?
Nope.
Nope. Okay. Then I'm going to, what is the name for this? Percuss. Thank you. We're going to percuss this. We're percussing the spleen. We're also doing the same for the liver. Great. Then I'm going to look for the edges of the spleen. I'm looking for masses. I'm looking for any problems along there. Okay, same thing on this side on the liver, looking for masses. I'm checking the edges, deeper palpitations there. Any pain when I did any of those?
Nope.
Nope. Great. Making sure that there's no obvious deformities with any of the legs or extremities. Both of those look good. Can you go ahead and sit up for me? Okay. So I'm gonna have you push my hands up. Good. Push my hands out. Perfect. Together. Awesome. I'm going to have you push against my leg, push against my hand. Perfect. How about with this other leg? Nice job. We're going to check the reflexes. Go ahead and bring your arm out to me. 1, 2, 3, 4, 5, 6. We're going to do the patellar, both sides. And we're going to do the Achilles. Okay. I'm going to take a minute, make sure that I got everything, head to toe. I don't know if I mentioned this, so I'm going to mention it now. We want to make sure that we look at the skin all the way down, make sure everything's intact. I'm going to check the feet for edema. So I look down here and make sure that there's no color change along the legs between the calf where the edema would accumulate. And I'm looking for signs of edema in the abdomen region as well. I think that's it. I think we got it all. Any questions for me?
Nope.
That's great.